Well, as families head outdoors for 4th of July celebrations, dermatologists are reminding everyone that a day in the sun, it can have lasting consequences. Joining us now to talk about it, Dr. Michael Christopher, known as the Melanoma Hunter, to talk about summer skin safety. We really appreciate your time. We're just into summer, so we really need your good advice. Good morning to you.
Good morning to you as well.
So look, a lot of people, they're going to spend the whole 4th outdoors, and then we're going to just be outside until summer ends. What is your best advice for protecting your skin during a full day of activities? Let's start there.
So, a very layered approach. So, it's not just utilizing sunscreen, it's applying all the other factors that are helpful. So, sun protective clothing, taking shade when necessary. And when you use sunscreen, making sure that it has a high enough SPF factor, which for me, I like personally at 50. I am in Tucson, Arizona, and that you put the appropriate volume on. So, if we look at our face solely, take the two-finger approach. So put sunscreen on your middle finger and your index finger, and that is enough sunscreen for your face. And then for your body, it's roughly 1 ounce. So think about a shot glass full, and that should protect your body.
Wow. Okay. Look, and we also often hear, look, it's cloudy outside, but you can still get sunburn on an overcast day, right?
Absolutely, yeah. So just because it's cloudy does not mean that you're sun protected. UV rays will get through a cloudy day, so make sure you're protected in that setting.
Look, also, we'll be going to the beach a lot too, in and out of the pool. What's the rule there as far as making sure that you're always protected if you're going in the water and say it's not a waterproof sunscreen that you have?
So one, you want to make sure you have waterproof sunscreen.
Okay.
So first of all, if it's not waterproof, and that is listed either as being water resistant, nothing is waterproof, or sport. So look for that. Make sure you're applying it about 15 minutes before you get into the water, and then reapply roughly every 80 minutes. And if you feel like you're getting really warm from the sun, I would even bump it down to 40 minutes.
Okay. When it comes to the little ones, the babies, any rules different here? Also, should that labeling that you see, like, baby sunscreen or what have you, is there a real difference here?
Yeah, so sometimes the baby sunscreens are a little more elegant and less irritating to the skin,
Okay.
but the rules apply the same. So I use both physical blockers, which is zinc oxide and titanium dioxide, and I do also use chemical-based sunscreens on kids that are greater than 6 months of age. But the same rules apply when using sunscreen on them. Keep them protected because a burn in childhood lasts lifetime.
Dr. Christopher, I remember like when we were young, we used to literally put like baby oil or some of the things to attract sun. We now know that is a huge no-no. Let me ask you about some of the other biggest sunscreen mistakes you see people make during these hot months.
So I think the biggest one is not applying enough sunscreen is probably the largest factor. People think it's protecting them, but the volume that they put on is very small. In addition to that, areas around the eyes, so you want to make sure that you get sunscreen on the eyelids and around where maybe your sunglasses would cover. 5 to 10% of skin cancers typically occur actually in that vicinity.
Well, look, before we let you go, you are known as the melanoma hunter. This is like the worst case scenario here if you don't apply some of the tips that you're giving us. But that moniker is because of your work detecting skin cancer. So let me ask, what should people be looking for when they're checking their skin this summer? And when is it time to go see a dermatologist?
So, great question. The number one thing when you are evaluating your own skin at home is if you notice a mole changes, you get that evaluated. So, that's very important. Getting a routine skin exam starting in your 30s or 40s is pretty reasonable to do. But when you see your dermatologist, they need to be utilizing a tool called a dermatoscope, which looks like a little magnifying glass, and applying it to every single mole so that they can find melanoma as early as possible. Because we know if we identify it at stage 0, you're safe.
Yeah. When we first started, did you tell your age? Did you say something about your age?
Oh, yeah. So, for instance, around 30 to 40 years of age would say no family history is probably a reasonable baseline to get a skin exam.
Okay, all right. I was going to say you look great, but it's probably because you put the sunscreen on and keep that skin looking young. That's Dr. Michael Christopher.
Always.
Okay, I'm going to do that too. Thank you so much for joining us. Have a safe summer.
Pleasure. Take care.
All right.